We're interviewing Wisconsin medical professionals dealing with the workforce shortage in that critical industry. Give us your name and title, please.
Good morning. My name is Bob Van Matron. I'm the president of Reedsburg Area Medical Center in Reedsburg, Wisconsin.
Bob, thanks very much. The report from BeBold says this: physicians and nurses represent a threat to public health, the shortage, a clear and present danger to state and local governments and our quality of life. Can you bring it home from a Reedsburg standpoint, please?
Yeah. So in Reedsburg, just like many other rural communities, we struggle to recruit and retain our workforce, our physician and nursing workforce in our healthcare industry. We operate a hospital and a nursing home along with a couple clinic operations. And what we've really struggled with in our organization specifically has been hiring and retaining our certified nursing assistants, or CNAs. Nurses, laboratory technicians, radiology technicians, and physical therapists. So recruiting and attracting people to our rural communities is becoming more and more of an issue that we're dealing with. To the point where even in our skilled nursing facility, our nursing home, we're actually not able to admit as many residents into the nursing home due to workforce shortages that we're experiencing. We, of course, have to be as competitive as we can because we're only about 45 minutes away from Madison, so we do have to be competitive from a salary perspective and so on, but we also have to maintain the cost of providing that care as well. So that's a balance that we're working on maintaining. Of course, we have to have an excellent benefit package to go along with the salary and pay for continuing education, those types of issues as well.
Have you had a turnover with physicians and nurses that's been as high? You mentioned the biggest issue is CNAs.
Yeah.
So are you seeing a turnover in all three of those professions, or CNAs most dramatically?
CNA really is the critical shortage area that we're dealing with, along with our nursing staff.
Explain how critical CNAs are to your facilities.
Well, in our organization, for example, our 50-bed skilled nursing facility that we operate, overnight we will typically have 1 to 2 nurses taking care of 50 residents. The rest is staffed by our certified nursing assistants. So having a shortage of CNAs really impacts the way that we're able to care for those residents.
If the lack of CNAs in your facilities is a public health threat, as the report says, whose obligation is it to address it? Is it a function of federal government, state government? Where should the incentives be?
Yeah.
And if you could fix it, how would you fix it? Wave a wand.
Yeah, well, clearly there is a threat. And in our organization, we're actually not able to take as many residents in our nursing home because we don't have the staff to take care of them. So it's hard to say no to a resident, especially a resident from our community, that we can't take care of them in our community because we don't have the workforce to take care of them. So the solution, I believe the solution is multifaceted. I believe the solution has to come from state government with programs like the Rural Wisconsin Initiative, but we also need to work with our training education institutions, our Madison College, our Black Hawk Technical Colleges, those types of programs, and then of course our hospitals, our nursing homes, our clinics. We all have to be part of the solution as well. So I believe there's 3 different organizations there that have to work together to solve this crisis. The hospitals have to have skin in the game. The hospitals have to train some of these staff. We have to work with the schools. We have to help provide the clinical site to their curriculum training that they do in the classroom. And then of course the state government has to be there to help fund some of these programs.
What's at stake if you continue to have a problem hiring CNAs? 3 to 5 years from now, what do your services and your facilities look like, Bob?
Well, we really have, if we're not able to fill these positions, these CNA positions, then we're forced to use more expensive help. That drives up the cost of care, which ultimately in our organization, we have to take a hard look at, can we continue to afford to provide these services in our community, which we provide at a loss, but it's more of a mission perspective for us than a money-making perspective. But really the end result there is if we're not able to hire the staff, we may have to look at closing down some areas of our operation, including our nursing home.
I'm Ann Zank. I'm the Vice President of Workforce and Clinical Practice for the Wisconsin Hospital Association.
Thank you, Ann. The BeBold report says this: the shortage of physicians and nurses represents a threat to public health and to the state's economic well-being. Clear and present danger to the state. Does that overstate it, Ann?
Nurses are able to be produced more quickly in terms of their runway to a career isn't as long as a physician. So for nurses, we've shown a track record in Wisconsin of being able to produce high quality, very excellent nurses in some cases in a 2-year college and then go on to 4 years to get their bachelor's degree. For physicians, we're already seeing a severe shortage of physicians, especially in primary care, psychiatry, family practice, obstetrics in Wisconsin. And that's very concerning because a physician's runway to a career is much longer. And so that's a much more difficult problem to turn around.
Which of the shortages most concern you, the physicians, the nurses, or the CNA type positions, statewide?
I would say statewide, the physicians and the CNAs are tied. Access is huge especially for an aging population, especially for vulnerable populations. And we are seeing that access, especially in rural areas, is limited by the number of providers available. And also, access and the difficulty in access is making it difficult for our physician providers to have that work-life balance that you talked about. So I'm really concerned about making sure that we have access, but also making sure that Wisconsin remains a state that's attractive for providers to come to. On the CNA side, we are just having a really hard time attracting people, so we need to work on making that career pathway attractive. But also, because it's a career pathway, I think we have to make the investment in the entry-level positions, acknowledging that we're going to turn those over really fast, that we're going to see a constant churn and a constant change in positions as people progress through their career pathway.
With the number of physicians that are choosing to retire as our population get older, that's part of the trend, then what can Wisconsin do to ensure that we have the next generation of physicians, nurses, and CNAs?
Sure. I think the Rural Wisconsin Initiative is huge in terms of making sure that the funding is there for collaboratives between healthcare employers, healthcare trainers like our technical college and our universities, and the government. So we need to make sure that those things are funded. I think we also have to continue to make it an exciting career to join. So using technology like telemedicine to support our care and access. And we need to think about things that physicians worry about when they join our state. Wisconsin's medical malpractice cap is currently in jeopardy, and we have to make sure that that's preserved, because that's one of the benefits that Wisconsin has over other states in terms of physicians wanting to come and work here.
Are Wisconsin hospitals doing more and more to train their nurses and move them up the career ladder, Ann?
Absolutely, absolutely. You're seeing more on-site training programs. You're seeing tuition reimbursement or tuition investment as a standard that hospitals are doing. We're also seeing more hospitals focus on increasing the number of bachelor's degree nurses they have, because that's, philosophically, nurses believe that a bachelor's degree is best, but we know we need those 2-year nurses also. The other reason that rural hospitals in particular are pursuing bachelor's degree completion in their hospitals is that helps them become better training sites for future nurses, because you need a bachelor's prepared nurse to precept or be the trainer for a clinical bachelor's program.
You mentioned rural hospitals. Do those have the most critical needs in Wisconsin in terms of being viable in the future, Ann?
I think that rural hospitals face special challenges because they're smaller, and the difference of being able to find an OB nurse or not can mean the difference between having an OB department or not. I think that they face different challenges. I think our urban hospitals have just as many challenges, but I think that rural hospitals have a harder time attracting talent away from the urban hospitals. I think that they are closer to the edge in terms of the difference of one physician or one nurse can be the difference in a small staff of having that program.
And then a final question from your perspective with the Hospital Association. What's at stake 4 or 5 years out if we don't do some bold changes?
I think Wisconsin for decades has had, in the top 5 nationally rated healthcare, and I think to sustain that healthcare, we need to have the workforce there to sustain it. And so we want to maintain the high excellence of our Wisconsin healthcare in our hospitals, clinics, nursing homes, and to do that, we need a healthy workforce also.
I'm Lisa Grill-Dodson. I'm the Dean of the Medical College of Wisconsin, Central Wisconsin campus.
You are training how many physicians?
We have 25 a year in our class and 25 a year in Green Bay as well.
And do you hope, or are they committed to practice in rural northern Wisconsin?
We aren't allowed to sort of have them sign in blood that that's what they're going to do, but we do select students who have an aptitude for living in a smaller community, perhaps in Wisconsin or in some other similar place, and who students who are interested in psychiatry and primary care as career goals.
Talk about the difference between the healthcare needs in rural Wisconsin versus some of our urban areas.
Well,
North and south of Highway 10, if you will.
Yes, exactly. So other than healthcare is healthcare. I mean, people need this. The diabetics aren't different in Milwaukee than they are in Tomahawk. But what is different is the scope of practice and the kind of practice that you need to prepare physicians for. They need to be able to cover the hospital and the emergency department and lots of different breadth of specialty. And so we're selecting students who have an interest in that rather than in super subspecialization, which is much more of an urban phenomenon.
Then what does that mean in terms of the population in northern Wisconsin? As you've seen the demographic numbers, Wisconsin is getting older.
Absolutely. It's getting older, so services are changing, needing to change, the kinds of physicians that we need. We need more geriatricians than pediatricians, for example. But the primary thing is a workforce issue is really to get enough physicians broadly trained and team-based training, because we know that they have to work with other folks to keep a small town health system going.
But the healthcare issues are different in northern Wisconsin, north of Highway 10, than they are in Milwaukee, right? People have to commute longer distances, and how else is the healthcare scenario different under both those regions?
It's different because of the scope of practice and the difficulty recruiting. So certainly when a physician leaves an urban area, it may take weeks or months to find a replacement physician. In the northern half of the state, you may be waiting years. There are several positions up north where we have students that have been waiting 2 or 3 or 4 years to try to fill a physician vacancy. So as physicians leave, it's a much bigger crisis for the community because they can't be replaced very quickly. And if you can replace them with temporary physicians, they often don't have the scope of practice or the breadth that is needed by the whole community.
What's at stake if this doesn't change in 4 or 5 years?
Well, people have to travel longer for care. Certainly there is the personal cost to our patients who suffer from not being able to get access to the care that they need. There's an economic cost as well. Businesses who have to make decisions about whether to build new facilities, the things they look at are healthcare and education. Are the schools good, and is there healthcare available for their workers? They're not going to invest in communities that don't have those two things.
Some of the major policy issues, wave a wand and try to fix some of the dichotomy, some of the disparity between healthcare in northern Wisconsin and in some of our urban areas. How would you fix it?
We need to do a couple of things. One is to reinforce and make sure that our rural hospitals are on solid financial ground. Some of that's a federal responsibility, some of that's a state responsibility, and some of it's the health systems that are kind of in negotiation for caring for taking on these smaller hospitals. We need to educate a different kind of physician for rural areas, so we need training opportunities that are specific to those locations. We also need to recognize the changing demographics and that elderly physicians and elderly patients are increasing in those communities, and we need to address the issues about getting physicians to stay in practice a bit longer with incentives, and we need to acknowledge that a different kind of care is needed for our aging population in rural areas.